prosthetic versus surgical rehabilitation in patients with maxillary defect regarding the quality of life, systematic review. Via oral and maxillofacial surgery. Abstract. Purpose: to assess the ability of prosthetic rehabilitation versus surgical rehabilitation in improving the call for patients with maxillary defects. Material and methods. A systematic search of PubMed, Scopus database, Cochrane database, Ovid database, and Latin America and Caribbean database for articles published before September 2017 was performed by 2 independent reviewers. A manual search of articles published from January 2000 to September 2017 was also conducted. Only English studies were included which evaluate the call in patients with head and neck cancers. Any confusion between the 2 independent reviewers was resolved by means of a moderated discussion between the reviewers. Results: 5 studies fulfilled the inclusion criteria for this study. Many parameters were used regarding evaluation of call as the ORTC Head and Neck 35 assessment, UW call, OHIP 14, VAS, OFS, MHI, HAD, Body Satisfaction Scale, Oral Symptom Checklist, Swallowing, Diet Consist, Pain Control, Postoperative Complication, and Speech. 2 studies supported the surgical line of treatment for improving the call as compared to the prosthetic one. Another 2 studies showed a statistically insignificant improvement in the patient's call with the surgical line, while only one revealed insignificant difference in call with both lines of treatment. Conclusions: surgical rehabilitation provides a better line of treatment in improving the call for patients with maxillary defects. On the other hand, prosthetic has proved effectiveness in the immediate post-surgical times as temporary strategy, and it has represented a good alternative when the surgical obturation is compromised.